integrated One Health joint support supervision, targeting mainly the healthcare workers at the facility, as well as the community structures, comprising of the community animal disease reporters and the community health promoters.
Is under Lokiriama Sub-County. Is one of our cross-border health facilities. We are also conducting supervision on immunization as well as surveillance activities.
The population that we serve here are nomadic pastoralists, all the way from southern Sudan side, Ethiopia side, and also the Ugandan side. Along this stretch, we have a good proportion, a significant proportion of the population are nomadic pastoralists, and their way of life means that they have to interact closely with livestock. They depend on livestock for everything, and this area has few health facilities, so that interaction between communities and health service is minimal. The interaction between veterinary services and the animals in this area is minimal, and in most cases communities here end up misusing antibiotics because of the lack of knowledge. They access these antibiotics. They use the same antibiotics to treat their animals, so it is uncontrolled. And these are issues that also affect food safety in us, because at the end of the day we end up consuming meat, consume milk from the same animals. So these are issues that affect us as a population.
Hapa Urum kama CHP na wadaktari ya wanyama, sisi tunaungana pamoja, tunafanya kazi pamoja. Tunaenda kusaidia wamama ambaye yuko na mimba, tunasaidia hiyo watoto ambayo hakuna nguvu. Kama sasa hivi watoto hii anakula plan B. Naenda kupima hiyo watoto hapa, tunajua kwamba hii mtoto hakuna nguvu, ama wazazi wake kuna kitu ambaye anaenda kulisha. Tunaleta hiyo mtoto hapa, tunaandikia plan B. Sasa sisi kama wadaktari tunaungana pamoja, tunafanya kazi pamoja.
CDRs, CHPs and CM are working in harmony, whereby if the CDR has found a case, maybe the death of animals, they normally report the CMs, whereby the CM report to the facility in charge or the nurse in charge. We go together, we confirm the case. If they need the case definition, then we contact the sub-county disease surveillance coordinator for the appropriate action.
So I think the most important thing that we've actually picked from this activity was the aspect of the human and animal transmission of diseases, where we've been able to interact with community disease reporters and community health promoters. And some of the findings that we've found is that there's quite a number of diseases that have been pointed out by community disease reporters, including rabies. We do have some few cases of brucellosis that have been detected in the community, but again, we are trying to find out their knowledge on the diseases, and also what do they do when they get these diseases. So we are trying to also incorporate the aspect of collaboration and teamwork together with the community health promoters, so that they can be able to detect cases together, share information at the community, and refer these cases to the facilities. And for the zoonotic diseases, one of the zoonotic diseases that we have picked from our registers that have been reported from the community, that is the true cases, the dog bites. There are quite a number of dog bites that have been reported in the last 3 months, a total of 6 dog bites. The most important thing is that the facility has anti-rabies vaccines, which is a preventive measure towards dog bite. And I think what we've tried to work together with the facility in charge and the CDRs is that they should report these cases on time, so that we prevent complications that arise from rabies disease. The community disease reporters and the community mobilizers are supposed to link the community with the facility. When they identify the cases, they refer the cases immediately to the facility and be able to work together when it comes to responses activities that are initiated at the sub-county level and also at the facility level.
This is a facility that is a bit far from the villages. So we've introduced outreaches which mostly target the immunization. And what we're trying to address is the defaulters and the zero doses, which we have so many of them because of the migratory pattern in the community. Through these outreaches, we are able to reach the defaulters. We are able also to identify children who have never gotten any immunization since childbirth because of the distance maybe from the facility.
Earlier on, we've been struggling much to sensitize our people to like and to come to the facilities. It was hard for the adjustment when we have been doing some mobilization and active research. Now they are now turning on positively. They used to come to the facility.
Challenges are so many. There are several One Health challenges that affect communities, and because we are looking at aspects of human health, environmental health, and also animal health, these are complex challenges.
Ile kitu ambayo iko shida hapa Urum ni kwa sababu ya ugonjwa wa wanyama, ile ambayo tunaendanga huko juu kuangalia wanyama. Nimekuta waraia anatoa hii dawa ya utarokoma na dungia ng'ombe. Ni kwa sababu anasema hii dawa ambayo daktari analetanga hapa hafanyi kazi. Tukudunga wanyama anaendelea kukufa. Na sisi kama watu wa Urum tutapata msaada namna gani? Sasa wadaktari hawezi kuja basi Urum kudunga wanyama kama hakuna dawa. Tunahitaji msaada, tunahitaji masomo, tunahitaji training kama wadaktari CHP, ndio kama tunaenda huko juu kuangalia wanyama na watu, ndio sisi hata kujua kwamba tunadunga namna gani. Tunahitaji hiyo msaada kabisa.
The mentorship is targeting specifically the community animal disease reporters and the CHPs because of the challenges that we face with the zoonotic diseases. Zoonotic diseases are diseases that are transmissible between humans and livestock, and therefore the only way to address these challenges of zoonotic diseases is through the One Health approach. The One Health approach also has structures at the community level, comprising of the community animal disease reporters and the community health promoters. There is also the aspect of environment where we want to bring in, and also we want to capacity build also the community structures that deal with the environmental issues at the community level, so that we are able to work together, collaborate together to be able to address these particular challenges. So normally what we do is we do joint trainings of the CHPs and the community animal disease reporters on priority vaccine-preventable diseases as well as priority zoonotic diseases. So we train these particular community structures so that they are able to do surveillance at the community level, and with their surveillance be able to report some of these priority zoonotic diseases either to the nearest facility or to the community mobilizer or to the animal health assistant within that particular area, so that we are able to intervene in an appropriate time and in an appropriate way.
Daktari huwa wanatufunza tukikuja kupata matibabu, wanatufunza kwanza kwamba kama sasa kama umepata mgonjwa ambaye ako na infection ya brucellosis, hiyo nyama tunaadvisiwa tusikule. Kama mifugo yetu ni wagonjwa, pengine upate kukunywa maziwa, tunaambia tusikunywe hizo maziwa, na pia tunahamasishwa tuwe karibu na hospitali most of the time ndio tuweze kupata matibabu.
Cha muhimu ni kwamba community promoters na animal disease reporters waweze kupiga report wanapoona ugonjwa wakati wote kwa wanyama na kwa binadamu, ili ndio sisi tujipange kama county kwa madaktari wa binadamu na madaktari wa wanyama, ili tuweze kuleta intervention ya kusaidia community. Kuna magonjwa yenye tunazingatia sana sana kwa binadamu kama vile measles na polio yenye ambayo inahitaji chanjo, malnutrition kwa watoto. Tumeongelelea na pia tumewafundisha ni nini wanastahili wafanye wanapopata ugonjwa kama measles na polio. Na tumekumbushana na hawa pia health promoters na community disease reporters from pande wa wanyama, ili waweze pia kukuwa na masomo inafaa ama knowledge yenye inafaa ili kupiga report wakati ufaao, ndio sisi pia tukuje kusaidia.
It's need for us to use a one approach, introduce the issue of antimicrobial resistance in our One Health program, because currently we are focusing on surveillance for vaccine-preventable diseases and priority zoonotic diseases, but by introducing the issue of AMR, we are going to fix this. There is need for us to strengthen regulation on issuance of antibiotics, that is over the counter. There is need for us also to build capacity of the communities. These are pastorals. There's need for us to tell them on how best to use the drugs, the right use of drugs, the dosing of the drugs that they have, especially for the veterinary drugs, provide extension services for veterinary and human health, bring on board the laboratory team.
It has quite a number of children who are under-immunized. Those are which we usually call them zero doses. We've been able to detect a total of 39 zero doses in the last 3 months from areas that are very far from this facility, and this is a good thing for the county and also for the partner, because we are able to showcase our immunization coverage and how we can be able to reach these cases from where they are coming from.
Now our people are now hearing what we are saying. That's why the things have changed. The indicators of infections in our place are reduced. Most like we've been seeing the last previous indicators of infections has reduced.
The default rate that we had in terms of immunization, the numbers kept on reducing, whereby with the help of the CHPs, we can trace the movement plan of the community.
For us as a team, for the support supervision, we are ready to support the team to be able to ensure that at least as we detect these cases, we are able to analyze the cases which are true cases and the cases which are not true, and being able to come together, sit down and come up with reactive activities that can be able to reduce the diseases that are transmitted from both human and animal.
One has helped us a lot, whereby the community has now embraced health-seeking behaviors, and also in terms of immunization, with the help of the CHPs, the people are now coming to the facility than some years back, whereby the community had known that in touch with the facility.
And up to now, we've done in this facility like 6 outreaches so far, and the numbers are improving in terms of immunization coverage, and we are also able to get the unimmunized children the 0 doses.
One Health approach needs all of us to come on board. One can do surveillance, another one can do food safety, another actor can come on board, do AMR, another actor can come and do other things. So at the end of the day, we provide a comprehensive service.
And therefore call upon joint collaboration, joint resource mobilization, and also joint coordination towards addressing some of these One Health challenges that we face.
Yeah, the stakeholder engagement is really important for both the partner and the Ministry of Health, because we are bringing all our efforts together.
So we need to bring everybody on board so that we work together towards addressing these challenges.
Madaktari MOH wetu wa Lokiriama Sub-County, timu ya Red Cross, timu ya IRC na wakubwa wengine wote kufunza, na wameweza kutuelimisha na wamefungua pia akili yetu. Tumejua kwamba tukipata hayo magonjwa na tujua hayo magonjwa yako, tuweze kuconnect madaktari haraka, tuweze kufanya kazi kwa pamoja na CHPs wetu na madaktari wa hospitalini.
Karibu tena Urum. Mungu akubariki. Thank you very much. God bless you.